The Juul, along with its products, has become a widespread public health epidemic among young adults in the United States and even children. Its impacts have reached everyone in some way, whether it be personally or secondhand. Juul Labs, the successful e-cigarette giant, has violated Food and Drug Administration regulations multiple times in multiple departments by marketing its product as a healthy tobacco alternative and appealing to underage impressionable users. Despite its popularity, however, Juul has detrimental short and long-term effects, creating a health risk for users. Juul creates addictions that are difficult to break and often results in financial hardships in addition to health and developmental issues. It is necessary to create awareness for this epidemic and advocate for Juul's demise so that no more children, teens, or adults are negatively impacted by Juul Lab and its products. Juul Labs is an e-cigarette company that produces a small flash drive-sized vaping device that uses a nicotine pod, typically fruit-flavored, that produces a buzz or a nicotine-induced high. Though it markets its products as a healthy cigarette alternative, it still contains toxins that are harmful to the body, especially harmful to young and developing bodies. However, the product is appealing to youth and has become a successful business empire, maintaining almost absolute control over the United States e-cigarette market. The company has violated multiple Food and Drug Administration regulations, making it ethically controversial, but Juul Labs still maintains its standing as the leading e-cigarette producer and distributor in the nation. Juul Labs marketed its products illegally as a healthy alternative to cigarettes, but the Food and Drug Administration, or FDA, never approved this because their statement was simply untrue. Juul still contains toxins and small amounts of carcinogens that harm the body. These false advertisements attract cigarette addicts by stating that the product is an alternative, even though it still encourages unhealthy nicotine addiction. Dr. Ned Sharpless of the FDA stated, regardless of where products like e-cigarettes fall on the continuum of tobacco product risk, the law is clear that before making tobacco products for reduced risk, companies must demonstrate with scientific evidence that their specific product does in fact pose less risk or is less harmful. Juul has ignored this law and, very concerningly, has made some of these statements in schools to our nation's youth. The FDA has written Juul several times in an attempt to gain compliance for regulations, but Juul has yet to change its policies. For example, Juul representatives have been quoted speaking at schools, according to the New York Times, and advertised their product as a healthy cigarette alternative with no concrete or scientific evidence to support their claim. Additionally, most Juul users have never used cigarettes, making the need for a healthy alternative almost obsolete. The FDA has also attempted to disallow the sale of Juul's fruity flavors in stores after the discovery of underage retail sales of Juul products both in stores and online. These sales are arguably the leading reason that youth are attracted to the product, leading to health risks. However, Juul has recently complied with the FDA's requests, and the sale of fruit flavors have now officially been halted in stores and online. There are now approximately 1,500 known cases of lung disease related to e-cigarettes or vapes, and a total of 33 deaths, according to the Centers for Disease Control and Prevention. These statistics have dramatically escalated over the recent months, disproving Juul's marketing strategies of being the safer cigarette alternative. These growing numbers have inspired Juul to halt its sales and have begun to face backlash from a small environmental group's nonprofit mission to attack Juul and its faulty marketing. Because of this nonprofit, legal action has been taken to monitor the marketing of Juul, such as where, when, and how they are allowed to advertise their product. Juul can no longer advertise at sporting events or concerts with an audience that is 21 years of age or younger. And most importantly, they are not allowed to visit schools as a way to falsely market their product to underage users as a cigarette alternative. Lastly, they are under strict instruction not to show actors under the age of 28 in their commercials, disallowing youth to identify with Juul users. To force Juul's compliance, the nonprofit is hanging the threat of a lawsuit over the heads of Juul Labs due to Juul's lack of previous compliance with the FDA conflict. However, though these commercials have restrictions, the Juul is still seen as a prominent public health epidemic.
In America, there are two ways in which healthcare services are delivered. The first being through medical care, which primarily focuses on treatments and curative medicine, and the second being public health, which focuses on preventative medicine. According to Mary Jane Schneider, author of the 5th edition of the Introduction to Public Health textbook, only 3% of the trillions of dollars the United States annually puts into healthcare spending actually goes towards public and preventative healthcare measures. A major public health issue in this country is vaccinations, and how those who choose not to vaccinate not only hurt the child that goes unvaccinated, but also the community that they inhabit. Herd immunity, which exists when a large percent of the population is vaccinated and protected from these pathogens, makes it difficult for diseases like the measles, mumps, meningitis, and others to spread due to us having a generally healthy and protected population. But because of the rising mistrust in vaccinations spurring from the media's facade, fear and public disapproval continues to rise, and concurrently, the amount of those who go under-vaccinated because of, quote, religious opposition. This can severely negatively affect the health of our nation if this population of and under-vaccinated people continues to rise. New cases of diseases that the United States eliminated and eradicated years ago could start to show up, diseases that once caused epidemics that swept through our nation. In order to continue to keep our country healthy, we need to be on top of those who are vaccinated and install higher regulations on them because they are a health threat to us all. We need to find a way to shift our country's focus of curative medicine more towards preventative medicine. With more funding and education going towards this issue, we would be able to maintain and enhance our public health by creating immunization clinics nationwide, for example, that help bridge the gap in our rural areas' access. This public health measure could help us stay above herd immunity for common communicable diseases and control the future health of America by keeping a rising epidemics at bay.
In 2015, it was reported that 39.6% of adults in the United States were obese. At least 30 million people in the United States have an eating disorder, with eating disorders having the highest mortality rate out of any mental illness. Additionally, studies have found that people who are obese are 25% more likely to suffer from a mood or anxiety disorder than those who are of normal weight. What do all these facts have in common? These are just a few of the shocking statistics that show the negative impacts of diet culture. Diet culture is detrimental due to the severe restriction diets entail, the dismissal of long-term health in favor of short-term results, and the institutionalized development of products. In the long term, a better understanding of nutrition will help alleviate the problem of the plethora of obesity-related disorders and reduce the effects of diet culture. But what is diet culture? Diet culture is essentially a system of beliefs that encourages a specific body type through the usage of strict food rules and promotes short-term weight loss. This way of thinking demonizes a certain body type and certain food groups while equating a kind of morality to foods. For example, many diets say that bread is bad while carrots are good, or that sugar is bad while raw honey is good. Most dietary experts agree that in moderation, all food can be enjoyed as part of a healthy lifestyle. However, labeling each food according to relative goodness creates anxiety for those who do subscribe to diet culture when they eat the bad foods, and it results in strict adherence to those kind of asinine rules, or binging and feeling extreme guilt afterwards. Now, to further explain why diet culture is harmful, the article "To Lose Weight, Skip the Fad Diets" cites a study conducted by Harvard University which tracked obese adults attempting to lose weight. By looking at their methodology, it was found that the best techniques for weight loss included eating less fat, becoming more active, and using weight loss therapies and medicines. However, those adults who followed liquid diets, used diet pills, and so on and so forth, did not experience long-term weight loss. Ultimately, the reader can infer that losing weight and living a healthy lifestyle is best achieved by making lifestyle changes rather than drastic temporary solutions. On the other hand, some people might argue that all diets are effective as long as a participant is in a calorie deficit. It is true that one of the greatest factors in a successful weight loss is achieving a caloric deficit, but it could also be argued that the manner in which one achieves their deficit is just as important. For example, according to a study conducted by David Benton and Haley A. Young, it is best that the dieter achieves a moderate calorie deficit in order to achieve the best weight loss results, which is 75 to 80% of the individual's daily maintenance calories, or the number of calories a person requires to eat per day in order to maintain their current weight. Additionally, the type of food one eats in their deficit and the exercise that they do helps determine whether or not they lose muscle or fat. So, for example, if a person ate 1,800 calories of curly fries a day versus 1,800 calories of lean protein, fruits, vegetables, and other balanced options, there would be a visible difference in weight loss results. While both of the diets consisted of the same number of calories, the macro and micronutrient composition would greatly affect the overall health of the participant. Through discussing this topic, I aim to help educate more people on the detrimental effects of diets and how to live a happier and healthier lifestyle by not subscribing to diet culture. By doing this, we are able to help people discover healthy lifestyles that work for them.